My close colleague, Dr. Shannon Scott, and I have been working together for about 15 years, developing a really strong program of research in knowledge synthesis and translation.
Knowledge translation is essentially about putting the best available research evidence to work. So we're trying to actively take the best available research evidence and put it into a format that's appropriate for whoever's going to use it.
In our case, it's getting information that we know from research into the hands of parents so that they can understand different childhood conditions and know how they can help manage their child's illness and when to seek healthcare services for their child.
We're just finishing up year 2 of our funding, and our funding had 3 main goals. The first was to collectively work with the Stollery Children's Hospital and Wickery to develop 3 new knowledge translation tools for parents, and we're well on our way in terms of that respective goal. The second priority was to really grow and advance our parent advisory group, PPEG we call it. So through this opportunity, we've been able to fund a full-time engagement coordinator, and that has really been fundamental for our success. And the third main goal of our funding is to take some of the tools that we've already developed. So at this point in time, we have 23 knowledge translation tools, and to do cultural adaptation work to make our tools more broadly available for people that are newcomers to Canada, for people with different cultural and linguistic backgrounds.
I think knowledge is power, and I don't think it reaches the intended audience unless it's shaped by that audience. And that's really why the funding from the Stollery Children's Hospital Foundation is so important. It's allowed us to develop a stable parent advisory group, and we can connect with those parents on a regular basis to really shape what we do.
We engage parents at all stages of the tool development from beginning to end. They often provide feedback on the style of the tool, wording of the tool, how informative and relevant the tool is.
As parents, we have a unique perspective of how we receive and consume health information. So when you're up in the middle of the night with a child who has a cough or a fever, you're looking for health information that is easily accessible. We have such a diverse group of parents that are part of the advisory group that it really gives a lot of different perspectives.
It is one of the longest running pediatric parent advisory group in Canada, so we're seen as the forefront of patient engagement.
We were developing an infographic on what to expect when visiting the emergency department.
When the pandemic happened, we were able to quickly modify that resource so that we could integrate information into it that was specific to the COVID pandemic.
If we didn't have the funding, we wouldn't have been able to develop both a COVID infographic and a COVID video for parents. Typically, we'd have to go back and request more funding, but because of this, we were able to pivot a resource we were currently developing and augment it for the current times.
As a parent myself, it's just really rewarding to be able to create resources that are meaningful to parents, that they can understand, and that really empower them and help them to make informed decisions about their child's care.
What I find really exciting now that we have such a large number of resources for parents is that they're starting to get a lot of traction. In Alberta alone, we have over 940,000 views a month. And that is phenomenal just in terms of the impact of this work. So we can't stress enough to the donors how impactful their generous donation to our research program really has been. We are really helping Alberta and Canadian families.